Good morning. Great to be back with you again. So glad to have you listening, making us the most listened to radio program on Saturday mornings in the area. That is fantastic, and I really appreciate that. Thank you all so much. You know, this year has been really interesting, and there's a big change coming a little bit later on in the year. We don't know exactly when, but we know it's coming, that there's going to be a new type of hearing aid device come to the market. It's going to be sold over the counter. You're going to be able to buy it just like any other consumer product. The rules and regulations aren't yet set on exactly what they're going to do, how they're going to perform, how much they're going to cost, any of that kind of thing. But already, manufacturers are trying to get ahead of this thing and taking advantage of it. So you'll see ads online for these hearing devices anywhere from $60, $70 to several $100s, and there's great concern that consumers are being ripped off. You're spending money on something that's not going to solve the problem, and even worse, there are people who are concerned that you're going to buy one of these devices, it's not going to work well, and if you have a hearing loss, you're going to go, well, I tried it, forget it, I don't want to mess with that anymore, when there are devices out there that can make a significant difference for you. Hearing loss is associated with a number of different conditions, everything from depression to low self-esteem to self-isolation, even advances dementia. So all those people out there in America who suffer hearing loss and aren't doing anything about it, now is going to be a good time to get smart. And that's why I've asked two doctors of audiology to join me today from the Hearing Center. They are Emily Beal. Good morning, Emily.
Morning.
And Allison Shorjan. Thanks for coming in, Allison.
Thanks for having us. We're glad to be back.
And I like to point out that Allison knows what she's talking about because she's had hearing loss since childhood and now wears hearing aids, and that's what got you into audiology. So
Yes.
you know this from the other side. So that's
Absolutely.
great. I'm glad to have you here. We don't yet know what these devices are going to be or what's going to happen, but the Hearing Center will offer an over-the-counter product, right?
Yes, the Hearing Center is planning to offer an over-the-counter product as long as we can find one that we feel like is going to be appropriate for the patient. I really actually think the over-the-counter hearing aids is a good thing for the consumer in the long run. I think it will help patients who have a more mild hearing loss where they feel like that cost-benefit ratio of the more expensive devices isn't there. But they are having some trouble and they need some help. And so from that standpoint, I really feel like over-the-counter is a good kind of segue to more professionally fit hearing devices. So with the Hearing Center, I think if we offer those over-the-counter devices, that will be kind of their first stop. And then when they're ready for more professionally fit devices, we're there to help them. We will also be there to help with that over-the-counter device, should they need it. The goal for over-the-counter is that really it requires minimal professional intervention, because that really is a big cost. That really is a big part of the cost of hearing devices, is that you're really paying for our professional expertise and time.
So mild to moderate hearing loss is what these over-the-counter devices are targeted for. People have no idea what that means, though, do they?
No, they really don't. And what you can think is subjectively for yourself a mild hearing loss maybe really be more of a moderate to moderate severe. So that's where, we as professionals are kind of hesitant and want to warn patients that you don't want to just go pick up one of these things. It may work for you, but you really should have that professional check.
Absolutely. I think, get that hearing test first,
Yeah.
see where your hearing levels
Right.
are. And then at that point, I think you can make a more informed decision as a consumer. I see patients all the time who come in who are like, no, I'm not having any trouble. And they have a moderately severe to severe hearing loss. And then I see those patients who have mostly normal hearing, and they feel like they're having a lot of trouble. So, it really is very individual to the person as well.
So the PSAPs, these things that are on the market now, are technically considered personal amplification devices. So they just raise all the frequencies, all the sound levels up. What's wrong with that?
Well, there are going to be the extreme cases, or there are situations where they will work, but very rarely. There are patients, or we know patients who just for whatever reason can't wear a hearing aid, and we've had some in the past where we've suggested these PSAPs. But really, for most of our patients, it's not going to provide that specific prescription targeted formula that they need. So, you can just basically get your phone to turn up the sound, and that's a PSAP. You can put some headphones in it and listen to sounds through your iPhone. But that's not really giving you the care and the specific formula and prescription that you need. They are also not going to PSAPs and over-the-counters. Best Buy is not going to tell you what to do if you have a sudden loss in hearing, or you're not going to have a resource if you notice ringing. They're not going to ask you those questions. And those are the things we do as professionals to find any red flags. Did you just lose your hearing? Do you have more hearing loss in one ear than the other? Best Buy is not going to tell you that, or when you go over the counter CVS.
Right. I also, when I think about PSAPs and just the overall volume up and down, if you think about most of the majority of hearing losses, they may have mostly normal hearing in those low pitches, low frequencies. When they get to those high frequencies, that's where they need more help. And so when you have this PSAP that's turning all of that up, they're going to really over amplify those low frequencies and probably not give them what they need for those high frequencies.
And again, that may be why the critics are saying, just because you don't have a PSAP that is working the way you want it to, don't let that sour you on what a professionally fitted and adjusted hearing aid can do.
Right. And most patients who have nerve hearing loss often experience the sounds getting really loud really quick. And they're very sensitive to loudness. So hearing aids have compression and features that we can activate and program to help address that. And a PSAP and possibly even some over-the-counter ones aren't going to have that professional knowledge and complete support that you need.
And these things are just not going to be allowed for kids, period, right? The OTCs, not fitted for kids?
Correct. The prescription for hearing loss for kids is very different than the prescription for adults. And so I would be really concerned to see my pediatric patients get these over-the-counter hearing aids, because it's not going to make sure that speech is audible. I think the second aspect that the biggest aspect that I'm concerned about with over-the-counter devices is if you look at the FDA rulings and their thoughts of what the rules are going to be, their output limiting, which is kind of the loudest sounds that they will amplify, it's loud, and to the point where consumers can really harm their hearing and make their hearing worse if they're at that point and listening to that level at a long period of time.
The technology associated with these hearing devices has really come so far, and now artificial intelligence is being built into not the OTC ones, but the devices that you provide. Tell me about what artificial intelligence is doing, how it's worked its way in.
So for several of the companies that are really manufacturers, they're working is how can we help the hearing aid, really make the hearing aid a brain, and essentially to distinguish what sounds are. So it's, our brains are trained to figure out, well, we got 3 pictures of a dog, we know that the cat's different. That's what these hearing aids are basically being trained to do, to distinguish what those sounds are. One product we've been recently featuring is something called Whisper AI, and what it's using is that artificial intelligence. It actually has a brain, literally, and it is a little box that you hold. But it's very easy to use. But the idea is that the processing is so much that they said you can wear the hearing aids yourself, but when you have this brain you're carrying around with, it's doing the majority of the processing. So if that's something, a patient would be interested in learning about, they can call our office and schedule a consult. And just like any of our consults, we're going to go over that. We're going to go over all the options and give them, what everything entails and really, dive into what their listening needs are.
Mm-hmm. More important than ever, all about, well, I guess I'm speaking for myself. I'm one of those baby boomers in the peak of the baby boom years, just getting old enough that I really need to start paying attention to that kind of stuff, because hearing loss is one of those things that just sneaks up on you. And you've told me before, it's often not the patient who recognizes the problem. It's the family member. It's the loved one who says, you're not hearing me. You need to do something about this.
And it is, in general, about 5 to 7 years before somebody actually does something with their hearing loss. Like if they've noticed it takes them 5 to 7 years to actually move forward. So, I think Allison made a good point. If some people can take advantage of these over-the-counters, if they've got just a little hesitation, then maybe they'll try that. And it is in what the FDA and what the government wants to do is they wanted to help patients get these access. But just like our government takes a little while, we've been talking about this for about 5 years now, and they're still not done. So, I think that just speaks to the amount that this shouldn't be treaded lightly. And that's good that they are taking their time. I think it's gotten lost in COVID and a little bit and such, but they're working on it. So, but it's just a matter of, it's not going to follow everybody. And the other thing is just making sure that you're taking care of your senses. We're going to talk about that later about COVID, but you wouldn't leave your eyesight, I think, over the counter. You do for a while. You have readers, but eventually you have to go see a doctor.
Great analogy there. And we are talking this half hour with doctors of audiology, Allison Shorgen and Emily Beal. Just recently went through a name change with marriage.
Thank
Congratulations.
You. Thanks.
And they are from the Hearing Center. They have locations all over Northeast Indiana, also in Ohio. Shifting the conversation now to COVID because it's affecting hearing. I've been reading about sudden hearing loss and an onset of tinnitus associated with COVID. Have you seen that in the practice?
Yep, we have, I think we're seeing a lot of cases with sudden hearing losses, and they come in, and of course, with with a majority of sudden hearing losses, we don't know what caused it, but very likely it could be a virus. So COVID is tends to be that virus these days. And so we've seen that. We've seen decreases in hearing, people just not feeling like they're hearing as well, muffled, extra ringing.
I would say even their ability to process what they're hearing as well. You hear a lot about brain fog, and I think that probably just attributes to that ability to process sound. I remember when we first closed down for COVID, essentially the whole practice closed down except we had kind of one ENT and one audiologist for sudden emergencies. And I was shocked, really, at the number of sudden hearing losses that we as audiologists saw during those first couple weeks when things were shut down. And often the patient, and it was tricky because they were complaining of sudden hearing loss, but they were testing positive for COVID, which we really didn't want them in our office, which tends to delay that treatment then. Wow.
So is it 1 year, both ears?
I think we've seen both. It can be the gamut. I have heard 1 year, I've heard both ears. I also recently actually fit hearing devices on a patient where she came in and said, I wasn't having any trouble hearing and now I can't hear anything. And it was a pretty significant hearing loss, but we had no baseline to really know, was it truly that her hearing changed, or was it that her hearing really stayed the same, but her ability to process what she was hearing became worse, and so she wasn't able to accommodate for her hearing loss.
And on top of that, the same person's probably having to deal with all the friends and family wearing masks. So that put another gamut. So you're struggling with your hearing, you're not feeling good, and then people are putting a mask on. It makes communication a little bit more challenging.
The masks do cause a little bit of muffling, don't they? Yeah,
just a little bit.
It's a little annoying.
Too much to the point that one of our hearing aids we work with actually is pretty cool. They have an app, and they have a mask mode. So that's how much masks have affected our society. I think that's really interesting. You can be on talking to somebody, and I say an application on the phone. You put a mask on, or in a situation it's just challenging, you actually touch a little icon with a mask and things get better.
Wow. I would say most of the manufacturers now have some sort of mask program because they have been shown to affect speech integrity and speech quality, particularly in the high frequencies, which is where most people, ironically, already have hearing loss. Not most people, but most people who have hearing loss are having hearing loss in those high frequencies.
Does it tend to, is it temporary? Is it permanent? Do we know yet?
With COVID and sudden hearing loss, I think it can be both. The tricky thing I think about sudden hearing loss is, somebody comes in saying, I can't hear out of my right ear. We do the hearing test and, they might have no hearing in that ear. We don't know, is that hearing going to resolve? Will it resolve on its own? Will it resolve with treatment? So usually the ENT physicians, their course of treatment is they're going to kind of stay ahead of it, and typically it's a steroid type treatment, either injected into the middle ear space or kind of an oral steroid pill, what have you. Sometimes, and we're always hopeful, they come back and their hearing resolves to mostly normal. I actually just saw a patient this week where they had a sudden hearing loss in one ear, and the patient was reporting that the hearing was better, and sure enough, they came back and the hearing did improve. What the tricky part is if it doesn't improve, I can think of one of my patients who had a sudden hearing loss, and we ended up fitting him with a type of device it's called a bicross, where essentially we're a hearing aid in one ear, a microphone in the other, because that ear can't process things. And so we fit him with a bicross hearing aid, but so he's hearing better, but his biggest complaint is in that sudden hearing loss ear, his tinnitus is so bad, and there's nothing that we can do to help that. And I think that's really where most patients are more bothered by the tinnitus than the decreased hearing.
And I think, some of your questions, they're just now really doing small studies. I know of one, but it was only 10 people. And I think they were talking about, they do feel it affected it. But again, it's such a small population number, we're not going to know. But if you think how much it's affecting senses of taste and smell, it's no wonder.
Yeah.
Another reason people, they were also saying because it's a respiratory thing, it could possibly, people are saying, well, how does it get in my ears? It can be coming up from the eustachian tube, which goes from the back of our neck up, or back of our throat, up into the ears. So it's that pathway.
Mm-hmm. Makes a lot of sense. So, and I've read that there can be a delayed response. So you recovered from COVID, and then weeks later you suffered this hearing loss. And yeah, it's crazy. Mm-hmm. COVID's just been such a mess all the way around for all of us. So if I think I have hearing loss, I'm just curious, should you have, even if you don't think you have a hearing loss, should you have a hearing test?
You absolutely should have a hearing test. You should have a baseline to at least know where your hearing levels are. Nobody thinks twice about getting their vision screened to see where their vision is, to monitor progression of vision loss. But for whatever reason, there's this stigma attached to having your hearing evaluated, have your hearing tested to see where you're at. Not only is it important to know hearing-wise where you're at, but if there comes a point where you feel like you've had a sudden hearing loss or a sudden change of hearing, it's always good to have a baseline to know, oh yeah, we did see a sudden hearing loss versus it's really just something you're perceiving, your hearing really hasn't changed.
And another thing that's important is if you do feel like you had a sudden hearing loss, COVID or non-COVID, doesn't have to be that way, that you call into our office. We will our best effort to get you in. That's something that I think a lot of people ignore. Maybe go see their family doctor and don't really stress that. They say, oh, it just feels muffled. Sometimes maybe they think it's an ear infection. They just let it go. So better to be safe, because as Allison already said, the earlier we can identify those losses and the doctors or physicians can treat that, generally the better outcomes.
Yeah. Sudden hearing loss is a medical emergency. Mm-hmm. Mm-hmm. It really is something that you need to get in within a couple of days versus waiting a couple of weeks or a couple of months, because at that point,
too late to do anything.
You're just too late.
Yeah, that's a shame. So what's an appointment is all I need? What's the cost for a hearing test?
That's the $1 million question. And we just actually had this conversation this week that patients always want to know, how much is a hearing test? Most insurances will cover the cost of a hearing test. So it really depends on what your insurance covers and what your deductible is and all of those factors. But from that standpoint, a hearing test varies also what we do from patient to patient, which is why it's hard to give a concrete answer of how much a hearing test is. I would say if you're self-paying that hearing test, I don't even know it right offhand, $100.
Yeah, I was going to say about 120, maybe something in there.
If you're self-paying.
But yeah, and that's where, but most insurances cover, at least Medicare usually covers one a year. So
with an order from a physician.
Yeah.
Yep.
Okay, that's great. We have to leave it there because we're out of time.
That's okay.
I'll let you know, they called me out and said, have you had your hearing tested? You should have a baseline.
That's what we do.
I'll be reaching out. We'll get that done. I'll
All
come and
right.
have an appointment and report the results right here in our future episode. Okay, so that is Emily Beal and Allison Shorgen, Doctors of Audiology from the Hearing Center. You can find them online at enthearingcenter.com with locations all over Northeast Indiana, also in Bryan, Ohio and Van Wert, Ohio. Ladies, thank you very much.
Thanks.
Thank
Good
you.
to be
Thanks for
back.
having us.